Sometimes in written exams, you'll get a question which bases itself on scoring systems. These are nice questions to write and sometimes difficult to answer because you've got an idea clinically, but the question may relate directly to a clinical scoring system. So we thought we'd give you one example, and that is of Wells scoring in DVT. Now, I'd like to say, first of all, that there are two Wells scores. There's one that's used for DVT, and there's another instance where you'd use a Wells score for pulmonary embolism. If your patient is pregnant or within 6 weeks of delivery, you should refer your patient immediately without doing a Wells score. With the Wells score, you allocate 1 point to each symptom and sign, and we'll give you those symptoms and signs now so that you can work through them. There will be 1 point if a patient has active cancer. That's if they're currently being treated or they're within 6 months of treatment or undergoing palliative care. Think of the 3 Ps: paralysis, paresis, and plaster. If a patient has any one of those, then they score 1 point. Bedridden patients are at a higher risk. They score 1 point if they've been bedridden for 3 days or if they're within 12 weeks of major surgery, whether local or general anaesthetic. A patient scores a point if there's localised tenderness or if the entire leg is swollen. When you're measuring the leg, measure 10 centimetres below the tibial tuberosity. They score 1 point if there's a greater than 3 centimetre discrepancy between the affected and the unaffected leg. Patients will score 1 point if there's pitting edema and contralateral superficial veins. Patients will score 1 point if they've had a previous DVT. If there are other plausible causes for the patient's symptoms that would explain the leg swelling or the redness, then you subtract 2 points from your Wells score. When you tot up your points for the Wells score, if the score comes to 2 or greater, then there is a significant risk of DVT and you should manage appropriately. If the score is 1 point or lower, then it's unlikely that the patient has a DVT.